This community analysis is of the City of Plant City by Timothy Lewis and Gloriela Alvarez. The objectives that we will be covering in this presentation are a historical overview of the community, analysis of the community, the structure, population, adequacy of health-related resources, environment, government, and public policy. We will also discuss 6 community needs and 1 global community issue. The City of Plant City is located in Hillsborough County. It is approximately 25 miles east of Tampa, immediately west of Lakeland, and 70 miles west of Orlando. It is located in the west central part of Florida. The city's history dates back to the early 1800s. The city's original name was Ikpuksasa, named after the indigenous population that lived here. In those days, the land consisted mainly of wetlands. In 1884, railroad developer Henry B. Plant brought the railroad system down to South Florida. In 1885, the city was incorporated and was named after Mr. Plant. Agriculture has always played an important part of the city's history. The main crop in the 1800s was cotton. Today, the main crop is strawberry. The city produces 3/4 of the nation's strawberry supply, giving it the recognition as the winter strawberry capital. For this community, cancer was leading deaths, followed by heart disease. In the nation, heart disease was leading deaths, followed by cancer. The increased deaths of cancer for this community can be attributed to the increased exposure to sun in the state and the lack of use of sun protection, as in protective clothing and sunscreen. Six issues that this community faces are homeless, lack of mental health facilities, poverty, migrant health, alcohol and substance abuse, and lack of public transportation. For the homeless in the city, there's currently no shelter that can provide them a place to sleep. Many sleep in woods or behind dumpsters. Anybody seeking shelter needs to travel to Lakeland or Tampa in order to get a bed. Mental health facilities. Currently, there are no mental health facilities in this city. Anybody experiencing an acute psychiatric episode must be taken to the emergency room where they await a psychiatric bed. Many of these beds are also outside of city limits, such as Lakeland, Tampa, or in neighboring Pinellas County. Poverty. The poverty of the city is above the national average. According to the U.S. Census Bureau, in 2014, 34% of the population of the city was receiving some type of assistance. Continuing with the community issues, migrant health. Many migrant families do not have access to proper health care. One of the reasons that they don't seek medical care is due to the language barrier. For many migrant workers, Spanish is a secondary language, as many speak a different dialect. Another reason that the medical care is not sought by migrant workers is the poor education and understanding of the medical health care system. Migrants and their dependents have more frequent and more severe health problems than the general population. Alcohol and substance abuse. During the windshield survey, many bars are seen in the downtown of the city. This leads to many problems as people end up driving under the influence back home. Public transportation. There is currently no public transportation for the city. This can be an impediment for those that don't have a car or that only have one car in their household. This can prevent the person from getting to doctor's appointment or overusing the emergency department as a primary care facility, as the car is usually available in the afternoon after doctor offices close. The global community issue selected was poverty. 17% of the population of Plant City is considered to be living in poverty, which is much higher than the national average living in poverty. Healthy People 2020 lists the top 3 barriers as lack of availability, high cost, and lack of insurance coverage. Many people delay getting preventative treatments or the appropriate treatment due to the cost of medications or co-pays that they have to pay. World Health Organization estimates that 1.2 billion people worldwide live in extreme poverty. South Florida Baptist Hospital, the local hospital in Plant City, is doing something to help patients pay for some of the medical treatment that they provide. The hospital helps patients fill out applications for family Medicaid, adult Medicaid, or county assistance. The hospital also has a hospital-based financial program that helps patients pay for some of the medical treatment that they receive during their visit.